Hello, everybody. So tonight we've got Deb talking to us about cranial sacral therapy. And so Deb does that. She's also a hypnotherapist, and the combination of both together sounds really exciting. So I get her to explain to me what she does, and I found it really fascinating. So I thought I'd have her on to explain what it is. And it fits in really cool with what we do, eh?
It does. Very parallel in the communication.
Interesting thing to talk about. So you can take it away, Deb, and just talk about first who you are and then what it is.
Cool. Yeah, so I'm Deb. As Justine said, do craniosacral therapy, which I originally got into in the UK. It is traditionally a branch of osteopathy, and it was designed by osteopaths, well, specifically an osteopath in the 1900s. And he, with osteopathy, you're very much feeling the movement of the bones, manipulating joints, and he looked into the skull and also looked through dissections and saw we all had sutures. And then decided, well, sutures have to come. Why would the skull have sutures if there wasn't a purpose to the sutures? So he did a lot of dissections, did a lot of analyzing of the skull, learned a lot about the sutures, and then realized that he was only ever analyzing sort of cadavers, so dead people. So he made a leather helmet and started compressing different areas of the skull for longer and longer periods of time, in which case he then presented with headaches, nausea, mental depressions, mental mood changes, and started correlating that different compressions through the head presented in different symptoms in the body. So that's basically a little bit about the origins of it. And from there, it's been developed over the century into quite a mainstream modality, of which there are a few different diverse routes that people take with it. So I was exposed to it studying osteopathy. I started osteopathy in London, and I remember my lecturers always saying, "Oh, you're very attuned with your hands. You'd be really good at cranial," and it didn't really mean much to me, but I played with it, and the main place for playing with it is actually underneath the sacrum. So I don't know whether you guys know what the sacrum is, but I happen to have back from the 90s. This is Fred. And so the sacrum, is it going to disappear? There we go. That's how old he is. So the sacrum, which is at the base, we place the hand under, we cup it under, and the person's lying down. And then from there, you feel a rhythm. And I used to do that with my massage clients. Obviously, the ones I knew well, lying there with my hand underneath the bottom, and progressively started to feel movement through it, started to feel a rhythm, and then got the idea of what I was looking for. And then from there, I learned to move around to different areas of the body. So the original thought process was, the movement of the plates within the skull, and obviously around the sutures, but then the brain is bathed in cerebral spinal fluid, which we now know goes around all the nerves as well. So when I've lectured in this topic, we've talked about how if you think about the pulse has got a rhythm, which everybody understands from the beat of the heart, we've got the same thing that will happen with the brain fluid. So as a therapist, I feel the rhythm, the beat, how strong it is, how weak it is, how turbulent it is. And then it's very much a process of allowing what I pick up in the body for the client to recognize. So it's considered very invasive, very gentle, and very self-healing. So whereas an osteopath might manipulate a joint, craniosacral therapist would bring the hand to the area and invite the change. And then the patient's body, the client's body is drawn awareness to it, and you feel changes through the craniosacral fluid. I find that the majority of people, if they know what craniosacral therapy is, it'll be from children. Midwives seem to be our biggest advocate because it's such an amazing treatment for newborns, especially with colic, because it's gentle, it's quite sedating, and yeah, it's a very, very easy, not easy one, but it's obviously a very gentle process to treat a newborn baby with. All of my kids had cranial as soon as they were born, and it's just quite magical, the changes and the calm you can see in baby when you when the baby reaches calm. Ariana, in response to your question about whether it can be done remotely, we were talking about this before. I have done it remotely. I have tuned into the rhythm remotely. It wouldn't certainly be mainstream. It wouldn't be something I think you would Google, someone who did this modality remotely, but I trained with people, with an osteopath in Finland, and he was also a yoga guru, and he did a lot of remote healing. And with him, I applied the techniques I learned through him and applied it to osteowork, cranial work. So yes, I have done it that way. Yeah, so it's developed over time. Nowadays, there are two different directions, but which is biomechanic and biodynamic. I've trained up in both, and in training up in both, I would say there is a lot of overlap, although people are either one or the other very proud. So the biomechanic is quite structural, so definitely from an osteopath point of view, they would learn biomechanic. You work with the joints, you work with the sutures, you work with the fluid. The biodynamic, on the other hand, is a lot more of the potency of the fluid. So how well the fluid, the strength of the fluid, how well it moves around the body. And then the other aspect that I'm really passionate about is using it for trauma work, which I've trained up as somato emotional release. And how I explain that to my clients is I sort of get drawn to, I call it a black hole for want of a better description. So it's like an energy center. So I get drawn to the energy center. I take my hands both sides of it and then work with the client to release it. And there's different ways of doing that. Some clients will just lie there and let me take control. Other clients, depending on, probably on where they're at, we would dialogue with the body, which is where I started to appreciate a lot of parallels with the language of hypnosis, because I find the language I used talking to the body really resonated with me when I learned hypnosis. Persis, I'll just have a look at your question. What do you mean by foreign parts? Sorry.
So I mean, if you've got screws and plates and stuff in your spine, like if you've had previous surgeries and if you have all these metals, how does it still work?
Oh, I mean, speaking from my partner was a hockey player. Most of his joints are metal and pinned, and he loves cranial. He finds it very nurturing. We're not going to be able to, obviously, we're not going to be able to move out of the restriction of what the plating can do. But one of the branches that I do work in and I really push for is kids with braces or any dental work, because if you imagine, if we've got the sutures, which are the joins between all the bones, and then we are fixing them with braces, it's not natural. We're losing an expression of the bones in the skull. So, and then you've got more kids presenting with behavioural issues, you've got more kids presenting with sadness, depression, mental anxiety. A lot of people I treat have had dental work. I've had dental work myself. I had dental work quite late in my life, and I would have it and then go and get cranial, because everything I learned suggested to me that I didn't want the dental work, but aesthetically I wanted the dental work. So I think it's just, you have to accept that it's very easy for me to say, don't get braces. It's putting compressions, it's fixating parts of the bones that should have a natural movement. But reality is we're a very cosmetic world. And so it's actually learning to work with these children and work with adults who want to go through these procedures and get the work done. So, sorry, questions. So Ariana, the principle is that we're teaching the client to heal themselves. So when I've explained that as well, if you imagine you went to an osteopathic chiropractor who might manipulate a joint, it's a very quick fix. It's very done. Okay. If you imagine what we're doing, think of a piece of silk. If you went to a chiropractor and osteo who cracked a joint, the silk would be yanked straight. If you think about the way I do it, imagine a crumpled piece of silk and just, easing it out. So it reaches its flatness that you're trying to get to, but it might take 3-4 days. So there's 3-4 days of which it's still processing through the system because it's a much slower, but because it's doing that, it is the body healing itself instead of me fixing and the person's having to come back. So it's a lot more. So people who advocate it's a lot more permanent. It's going to be slower. People still love chiropractors because they can 10 minutes once a week and they can feel amazing. I get referrals from chiropractors because some people just want that permanent change. So it might be more of at least a 45-minute, an hour treatment. But it lasts so much longer and you get a lot deeper change and a lot more thorough change. So
what does it look like when when you touch the part, so say you're finding an area, is it like massaging, or what do you actually do with that part?
Super gentle. So my hands would be the other way up, but basically it's just resting. We actually say that the pressure that we apply is no heavier than like a 10-cent coin. It's very gentle. So it is literally apply the pressure and then melt in through the tissue. So I know, Justine, we talked about this once before, but if you bring those of you here, if you bring your arm out and you're just resting your hand on, and then your intention, which is as much as the intention goes, is just to melt into the tissue system. And then when you feel like you've got an engagement, you just listen. Just be there, just be present and feel. And what you're waiting for is a rhythm, a flow of the fluid. And the fluid, we call it tide. So there's considered a long tide, a medium tide, and a short tide. Different therapists will work in different tide lengths. And it's just literally just feeling the flow of the fluid. A biodynamic craniosacral therapist would work a lot more in long tide, which is the really slow one. I use that a lot more with trauma because it's very gentle, very slow. And, I could spend 20 minutes just standing at the feet and just from the feet. So I'm literally holding through the ankles. From the feet, I'm feeling where I'm going. And then from there, it's very intuitive work. So I'll be drawn to an area which for me feels like an energetic pull or a torsion or twists and turns. I remember working on a girl who'd had quite a few miscarriages, and literally it was like from the moment I put my hands on her ankles, it was like a whirlpool. Her body was just swirling and swirling and swirling. So working in the long tide, working really distally, so quite far away with those kind of people, is a lot more calming and a lot nicer way for them to find themselves again, because you might find that the people are quite out of their body. But it's very intuitive work. I came from a very, very strong science background, and that would have been why the cranial took longer to appeal to me, because the cranial is very much about trusting what you feel, trusting the messages that come in, trusting what you sense, trusting what you're drawn to. Whereas coming from a more osteo massage point of view, you're very physical with the way you treat. So it's certainly been something I've embraced later on, when I've allowed myself to trust my intuition instead of trying to academically rationalize everything I do.
So with say we have clients coming in for different things, what clients would suit having this done with alongside what we're doing?
So I would definitely well, this is interesting, because what I found with the trauma work, and what's amazed me is what I might accomplish in 10 cranial sessions from like the techniques I've learned from Justine, I can do in one session. But what I'm then finding is then if I go to the body, quite often what they symbolize being pulled out, they then find in the body. So I might be drawn to an area that potentially is holding the trauma, and then they will see that same vision of what we pulled out and maybe in a symbols technique. And that's been really interesting for me to go, wow, okay, so we've physically done a pulling out of the body, and now I've almost been drawn to that body part. So certainly I feel like the trauma, it's a really nurturing and gentle way to finish off a treatment as well, or to finish off a hypno session. And otherwise, a lot of structural stuff, a lot of things that just don't make sense, postural irregularities. You can work with the organs. So if there are diseases that don't make sense, or autoimmune, which triggers anywhere, and you can work with the body. But I love mixing it in with the symbols and just having that balance of working with it that way. And it's been interesting too, because traditionally how I'm trained in cranial with the trauma work is we talk to the body, we talk to the body part, and the person talks to the body part. And sometimes it can be quite full on, and you come out of it. I know when I've received a lot of this work in the past, I used to literally go to a coffee shop for 40 minutes and sit and drink a whole pot of tea before I could feel like I drive anywhere. Whereas now I don't actually even treat like that. And now I actually use what I've learned through hypnosis, and we don't follow a picture and imagination and a pathway. And that's because what I've learned as well is that resonating of what are we creating in allowing this imagination to unfold. I've had some pretty full-on imagination experiences that have sat with me for a long time, and it does make you question, is it real? Did I need to do it that way? And whereas I find if I mix the hypno language and mix the GT work and stuff whilst I'm treating, we can just clear it without revisiting and without going through imagination work. So, Justine, you had a question just on the sutures. I did. We can all, if you go through some of the main sutures, if you go through that mid hairline, and the suture pretty much starts the middle of the head and you rub across it. Sutures always feel really nice to massage. So it's like a ridge. And then the other ones, they're at the side and they're the ridges. So when we do quite specific cranial work, there's another one mid-cheekbone. It just comes in from there. And so what I would do is if I'm working specific plates of the skull, I would hold within the suture. I certainly don't hold like this, but I can't get my hands upside down. And then there's other times where you'll embrace the whole head and try and encompass a lot of the sutures and try and get the overall picture. So it's very listening, try and get the overall picture of what's going on. So can the rhythm be hard to discern from the heartbeat? What we have what's called listening stations, and sometimes you go to different parts of the body just to see what's going on in the listening stations. Rather than the heartbeat, what tends to be difficult is when you work through the torso is not getting caught up with the breath. That's actually harder, because quite often the breath is probably more similar to the feel of the rhythm, whereas the heartbeat is very boom, boom, boom. This is a lot more of like a wave, so it doesn't have that same pulse. So normally it's actually more when you're working around the lung area that you have to make sure you don't get caught up in the breathing pattern and get swayed by feeling the breath as opposed to feeling the rhythm of the craniosacral fluid.
So that fluid, it flows down through our spine and our nerves from our brain.
And it secretes from the fourth ventricle, which is based in the middle of the skull. And I will show you, I've just got to do this screen sharing, which I'm not the best at. I worked it out before and then I can't remember how I worked it out. Oh, there we go. So I just found this picture because I quite liked it. So this is a really good view of the inside of the skull, but it shows you the sutures through here. So what Sutherland originally prophesied was why, everything has a purpose in the body. So why would these sutures be here if there wasn't a reason for them? Now, so if you think that the brain sits in here, and we all know from hypno that, the different parts of the brain covers vast different modalities of learning, vision, everything that goes on within the body. And this is part here. We've got the brain that sits and cusps around here. We've got the pituitary that sits in the middle. And then embracing all of that is 3 layers of brain tissue, which we call dura, which also feed down through the spine. And any torsions, any tensions, just like, a tight muscle, a tight fascial system in the body, any twists or torsions can all happen in the skull. So when you think about that, then you can start understanding why, people might present, people might present with headaches or, eye disturbances, but more complex, we've got nausea and behavioral issues. But it's just, there's such a complex going on within this area. Whilst we're here, I will talk about this bone here, which is called the sphenoid. And we call it the butterfly bone. It actually mirrors whatever is happening in the pelvis. So we all naturally have a dominant leg. We've always got a leg that we will climb stairs on. We've always got a leg that we will push off with. So if you think that over the years, we're going to very naturally have an imbalance of a stronger side and a weaker side, which is going to naturally put a twist through the pelvis, this mirrors it. Now, this is called the butterfly bone. It's supposed to float. And ADHD, autism, this is my absolute go-to. And what we do is we feel what we call the breathing rhythm of that bone. So it's supposed to have like an arcing forwards and back, but you might find it has a tension to the side, or you might find it stuck here, which means that this side is moving freely, but it's ended up with a rotation. And all of those present with behavioral issues from what I find. But definitely the autism, for some reason, the autism sticks and it stays stuck. You can free it and there's an amazing release of symptoms, but it seems to gravitate back down. Most others, once it's released, it has a really, it holds its release. So you can see huge changes. I just put up this one as well, I think. Yeah, so that's it from the outside. So this is the frontal bone coming down through here. The parietals. So all of these suture lines, and you can feel them. So this one here, yeah, you quite often get babies who, you know, when we were fixated on like keeping babies in one set place in the cot, and then you get a flattening of the skull, which is going to compress through a suture. This is the temporals, any hearing, anything auditory processing. And then this one here is that sphenoid that I was talking about, which mirrors the sacrum. It's in the back of the eye socket. And that one, yeah, that's just my absolute go-to to treating people. So I will just come back to so yeah, were there any other questions?
That little squiggly bit that was there, that came up there, is that that you can just put your hand and feel it in there?
Which bit here?
So
where were you?
The skull, it had like a one of those suture things that kind of squiggled up to about there.
Yeah.
Where it joined. Is that somewhere?
So this one at the front is full. The only suture through here is the top of the nasal. So if you're really congested and like such a simple technique, like anyone who's got hay fever, anyone who's, you know, prone to allergies and colds and stuff, the bones here are just, they're really short and really light. If you just rest super gently and then just, you know, just tell yourself, just ask the bones to just disengage and try and follow them. And honestly, people just like, oh, I can breathe. And they don't expect it because it's not something they're necessarily presented with. But, you know, I've read the case history and you see allergies and it's such a simple fix. But yeah, even when you're sick, just resting your fingers either side and just allowing it to open. And it's very much that magic of just me bringing my fingers on almost makes the body go, what's going on? Why is she there? Is everything in order? And then the body just helps to resolve itself. So it's pretty cool. Coming to the sphenoid, it actually sits, if you follow up from the eye, so at the end of the cavity of the eye, and you feel like a real gentle dimple. And just press in there. And even just closing your eyes and just see if you can feel movement. What you want to be able to feel, I'm going to exaggerate it, is this comes forwards and back, forwards and back. What you might find is one side, you might find it shifts, but and I reckon, you know, you guys, there's no reason why you couldn't just say, especially working with super conscious, you know, just please rebalance the sphenoid, bring it back to equilibrium. And just follow it. That it's such a powerful, for kids, for all sorts, it's such a powerful center to work on. But that is actually the only access point. Like when I do it, I'll mirror it, I'll join it with another bone. But when you're just working on it yourself, make the contact and then just lighten the load.
When I do it, Deb, on my left hand side, it feels like little electric shocks tingling, like bzzz.
Down through your fingers.
Yeah, but only on one side and not the other. Like, honestly, like getting a little shock.
So what you can do, if you imagine, and this is more imagine than any necessarily feeling, just imagine like shifting it slightly to the side. And then go and just let it come back by itself. So real gentle, imagine a little bit of a gentle press, allow it to come back. Sometimes that you can do that to help unstick it. And there's different, like sometimes we will completely follow the movement of the bone and actually take it into the movements and try and exaggerate the movements in order to try and free up one, especially if one's particularly tight. But just tell me if that makes a difference to that sort of tingling shock sort of sensation. Joanne, could craniosacral therapy be beneficial for someone recovering from stroke, spinal head injury? At what stage of the healing process would you recommend beginning this therapy? Once the inflammation is coming down. So I work a lot with concussion, head injuries. You just wouldn't do anything in that really early acute stage. Post-surgery, you know, probably if you imagine like a natural inflammatory process of it like 72 hours, just give it a couple of weeks. If you're not sure, then you would basically get clearance from the doctor. But it's, and also it would be very much a case of, if it's very new, it would be a case of allowing the release. You know, there's just got to make sure there's really no intention in your work. You're just really allowing what will go on. Friend of mine, I worked concussion pretty soon, and she worked alongside a concussion physio, and the concussion physio couldn't believe the speed that she recovered. But she was working, she was really like, who do I know? I want to get back to work. She was on ACC. She had a massage practice. You know, she needed to get back to work. And so she just reached out to everyone in all the modalities that they did in order to get support. So there was a question about acupuncture. I do dry needling, and I have done the two together and realized that was really overload on the body. I wouldn't do that again. It's like two energetic systems that caused, like the person was exhausted and wiped out. But similar, you know, the acupuncture has that similar mindset of taking 2-3 days to unfold, to find its new beat, to allow it to really come to a new place. So any of those modalities, I've been working with a lady, I work with quite a few who have proper Chinese acupuncture and come to cranial, and all I say is just give it the 3 days, you know, so do a split week. Try not to have those kind of treatments within the same 3-day period, because all you're doing is you're actually putting so much overwhelm in the system that it's going to interfere with the natural healing that that those processes are trying to do. So either alternate weeks or, you know, Monday, Thursday, and try not to, just try and be really kind to that 3-day process of letting things find their feet. And that's what I say to my clients too. They'll quite often say, well, when do I come back? And I've got an autistic girl that we've worked out that 2 weeks seems to be when she really starts to fire up again, but it's such an individual journey. You know, it's I just say give it the 3-4 days. I would suggest at least 2 to 3 weeks for a first treatment, and then just get back in touch. I've had sessions weekly. I've had sessions twice weekly. That was for heavy trauma work. And then what I'd find is I would probably do that for about a month, and then I just went AWOL. And I'd go AWOL for 3, 4, 5 months, and then I'd book in again and just do a real heavy month and then do the same thing. But that for me is, I think, part of my processing. I needed to understand, and I needed to gain, to learn who I was in this new body, in this new place of healing. So it's very individual to how you respond to it. And that's basically what I say to people. Yes. Persis, definitely. It is so gentle. Stopped a lot of people having surgeries. Not allowed to say stuff like that. But it is such a nurturing way of bringing hydration back to the joints and realigning them. From an osteopathic point of view, like even if I get Fred back, diverging, with the discs, they will bulge naturally anywhere through life, okay? The problem is when the bulge hits a nerve. So, and for me, cranial, even osteochiropractors, what they do is these joints compress together. They might pinch through a nerve, you lose movement, then the hydration's lost through the disc. The cracking alleviates the joint, but quite often, if the muscles aren't worked on, then it will all return back. So for me, the cranial, it works the dural system, which is those wrappings, those membranes around the brain. It helps the health of the disc. We can work through the nerves. We specifically, there's like movements where you can release nerves and you can work through nerves. So yeah, completely. Anyone with any back issues, I would urge to try this kind of treatment, definitely. It's a no-brainer, and it's so gentle and nurturing. You know, it's you're not yanking or anything else. And I mean, traditionally, the person lies closed, face up on their back. That's traditional. You know, I can treat someone in any position. I had a 4-year-old girl the other day who was squirming around everywhere, you know, and I probably had about 5 minutes of really, we were playing Disney music and everything, and then literally there was an area in the skull that it just went, and she just went, and song finished, and then she's off again. But that 5 minutes was amazing. Cranial covered through ACC? No, not unless you are an osteopath. A craniosacral therapist is not, but an osteopath who does cranial can, because it falls under the umbrella of what they do. So, yeah. Cool. What does it not work on? I think like anything, it's the potential is there. The block can be the person. it's not going to work on someone who doesn't think I'm doing anything. You know, it's not going to work on. I remember when I was doing a lot more massage as well, you know, I would have those real high-strung type A business personalities who I knew would thrive with cranial, but just wanted me to cause pain and do deep tissue, and you actually knew that what their system needed was something like cranial. And I'd try and throw it in at the end, and I might get 5 minutes out of them, but they would never permit me to do a whole hour. So I think the biggest thing that it won't work on is that lack of belief, because at the end of the day, it is very gentle touch. And yeah, you've got to trust your therapist. You've got to believe your therapist. So, because it's such an internal system, you know. And I went through that too, you know, when I was in London and I was training, and I know that my sister-in-law for her first child was trying to find a craniosacral therapist, and she would take, and it was before I was doing cranial, and she would take me along, and we'd go there going, did she do anything? I don't know, you know, because that's a bit what it's like, especially with a baby. It's like, what's going on? Yeah, so, but then you get other people who, I had a new client a couple of months ago who I said, look, it's very gentle. She'd never tried it before. A few people had told her to try it. And she said to me, she said, yeah, you told me your touch was very gentle, but on the inside, I felt like I went through a dishwasher. She said she felt so much movement on the inside. And some people don't. Some people go through very vivid imagination stuff, colors swirling, in and out of like daydreams, consciousness, that kind of stuff. For some people, they just go very, very deep. But again, that will also depend on probably what's going on for the person, more so than the treatment. So
within, you know, when the nervous system gets wired, things like your lower back, you know, squeeze and to run away from the tiger, and all these kind of things happen in our body.
yeah.
How does that affect the flow of the fluid? Is it like the you know how when you go to chiropractor and the message is going through to your organs and stuff, does having your nervous system like this all the time, does that affect the flow of it as well?
Yeah. Some people I'll spend 20 minutes, probably not 20 minutes, but you know, some people I'll probably spend a good 10 minutes before I feel like I felt their rhythm. And that even might feel because I don't feel like they're grounded. I don't feel like they're connected to their body. People who've had a crazy day, who are exhausted, it's like so light that if you didn't know what you're feeling for, you wouldn't feel like you were feeling it. And then on the other side, you've got that high strung, like it feels like it's on fire, you know, it feels like it's full of, you know, it's just like it feels like it's boiling without heat kind of thing. So yeah, it's very, very different feeling for different where you're emotionally, and people coming in from different the same person coming in from different weeks, depending on what's happened for them during the week, the rhythm will feel different. So yeah, but certainly, yeah, like if any of you've got kids, my son, he doesn't do it so much now, but as a kid, I would literally put my hand underneath. So say he's lying in bed, I will put my hand under his sacrum, and you're basically following the curve of the sacrum, and he would just fall asleep. And it would just, for him, it was so, whether it was earthing or I don't know what, it would literally just take him. It was almost like an earthing line. you know, take away all the day's tensions. But the sacrum is where I used to always get my students to. When I used to teach massage, the cranial paper was always quite advanced. But I used to talk cranial to my massage students straight away. And I used to say, if it's something you want to try, get used to putting your hand under the sacrum and just see if you feel anything. Because it's I think you're in a very relaxed place. The person's in a very relaxed place. Their weight's on top of you. If you're on a bed, then you've all got that cushioning down, so it doesn't feel heavy. And it's just a really good place for you to be able to learn to feel the rhythm. So surrogacy, I have never used it with surrogacy. Yeah, I've never no, I've never done any situation with a surrogacy like that. I've either been direct on the person or I've worked remotely. Yeah, so yes.
Awesome. Very cool. Something very different, eh? Like, so for people listening, my idea with getting people on talking about these different things is that, you know, if something resonates with you and you find it interesting, then you find someone in your town that does it and connect with them. And then you can have a kind of system going where, you know, if you feel like one of your clients would benefit, then you send them to them. And if they feel like their client would benefit, if you talk to them about what you do, you know, and you can have kind of a connection going with someone. And Deb is in Auckland. Whereabouts are you, Deb?
Yeah, I'm in Auckland, central Auckland.
Into Auckland. Yeah.
I'm not currently teaching. I used to teach at Well Park, but it was pre-children. So I'm not currently in a lecturing. No. But we were talking about whether or not I could
Just something be so much fun.
come up with even just, you know, just the basics and stuff.
A weekend workshop would be heaps of fun. But
yeah.
But Deb, you're there to take on clients and you do the hypnotherapy as well in Auckland. Yeah, so it'll be really interesting if it's something that you you like, you know, what you see. It's a good thing to buddy up with people in your area and get a referral network going. Yeah, but that was so awesome, Deb.
Cool, thank you. Yeah, no, it's it's pretty special. But I do love the way the hypno works with it. I think it's for me, I think I've gone very broad with my education, but it's always about, you know, going down every avenue I can find what resonates with me and trying lots. You know, I really urge people just to try different things. That's the biggest thing. And I've even noticed that on, you know, like when I go do my yearly cranial course, you see the people who haven't received many treatments and the stuff that just doesn't resonate with them. So like any of us, I think hypno as well, you know, you've got to receive it. You've got to try things out to understand what it feels like to receive. So yeah. Cool.
Totally awesome. Any other questions before we say goodnight?
I will do one because I know there was a request to do TMJ.
Oh, yes,
yeah. So this is you're feeling the cheekbone, and then you come underneath and you're heading into the jaw. Okay, just almost cup it around, and then the mandible, which is the jawbone, actually comes when it has its breathe. So all these bones are considered to have a breathing pattern, which is what we'll tune into. So the mandible is actually considered to open out and come forward. So if you're resting your hands on it, it's actually just that case of just engage in. So just melt with the tissues, and then almost feel like you're disengaging, allow it to come down.
Do you need to press in there?
No, super gentle.
Just
So,
gentle.
like it's just like resting a coin on the skin. Super gentle. So you engage in, you ask to be melted in to the tissues, and then you just bring literally it to a very gentle touch. And then if you did anything, you could just invite it to relax, invite it to disengage. But otherwise, just follow the movement. And remember, the movement is tiny. You know, our jaw does not come off, but it's just that softening through here, relaxing off. Like I just done that, and I felt the release through here. So, yeah. So it's pretty cool. But you could do that anywhere. If you've got a headache, bring your hands to the back of your head. Just go right, melt in with the tissues, engage with the tissues, and then almost back off. You know, and just invite the tension to ease away, invite the bones to just relax into your hands, and then just feel the movement. So